Good morning, everyone, and thank you for joining me today. I'm going to be discussing childhood disorders, including children affected with autism, ADHD, and anxiety. This is just a disclaimer that I'm not giving any medical advice to anyone. Of course, before starting any type of treatment, always consult a physician. Just to give some of you a background on who I am, I graduated from Western Michigan University in Kalamazoo, Michigan. Then I traveled down to Port Orange, Florida, where I received my Doctor of Chiropractic degree from Palmer College of Chiropractic. I currently practice natural medicine in Berthoud, Colorado, and my office name is Gateway Natural Medicine. I have completed both of my diplomates in the American Board of Chiropractic Internists, as well as my diplomate of the American Clinical Board of Nutrition. I'm currently board eligible for both of these diplomates. So we'll just get in and jump right into things. I'm going to kind of start off with a few statistics. So autism is currently estimated that 1 in 68 children have been identified with autism, and it's 4.5 times more common in boys than it is in girls, affecting 1 in 42 boys in comparison to 1 in 189 girls. A lot of this research has shown that parents who have a child with autism have a 2 to 18% chance of having a second child who's also affected. Studies have also shown that parents who have children with autism notice a developmental problem before their child's first birthday. Concerns about vision and hearing were often reported in the first year, and differences in social, communication, and fine motor skills were evident from 6 months of age. Now, these statistics come from the CDC, so it's the most updated data that they have on their website. Unfortunately, it takes them a lot of time to put this data together, so a lot of this is from 2011, maybe some of the more recent stuff from 2014. So it's estimated that some of these numbers are probably increasing over the last several years. So this diagram shows the incidence of children affected with autism. As you can see, in the year 2000, when they surveyed the number of children with autism, these children were typically born in the year 1992. And around that time, it was affecting 1 in 150 children. As you can see on this chart, the most recent year was 2012, and that is when they were finding that 1 in 68 children are affected with autism. So you can see that this number has increased significantly in just the 12 years that they've been monitoring this. Attention deficit hyperactivity disorder, otherwise known as ADHD. This is one of the most common childhood disorders, and approximately 3.35 million children are on ADHD medication. And it's estimated that about around 6 million children have been diagnosed with ADHD. This is a pretty significant number. This graph shows the number of children that currently take medication compared to the children that currently do not. And as you can see, that's a pretty high statistic, 69% of children. That is a lot of kids that are taking medications for ADHD. This also shows the trends in number of children that have been diagnosed with ADHD. So as you can see, the dark blue line represents male. The light blue line is the total population, and the blue line represents females. So as you can see, this ADHD is also more common in male, like autism is. Anxiety. Approximately 31.9% of adolescents have any anxiety disorder. And when they're talking about adolescents, it's referring to the age group of around 12 to around 17. The prevalence of many anxiety disorders are more common in females than males. So autism and ADHD occur more frequently in males, but anxiety type disorders occur more commonly in females. And this is just a bar graph showing the number of children affected with anxiety from 2001 to 2004. So as you can see, females are significantly higher than males. Overall, the number is pretty high, 31%, and then severe impairments, 8.3%. So you can see that these numbers slowly start to increase as children get older. So the 13 to 14 group has around 31% affected, whereas the 15 to 16-year-olds have about 32% affected. And this number just continues to increase as adolescents move into adulthood. Autism. So we're going to get into some of the research and testing that they do with these children. Symptoms of autism can include social impairments, cognitive impairments, coordination issues, anxiety, difficulty expressing their emotions and what they want, and typically there's normal development with regression around 1 to 2 years old. So we're going to get into that a little bit more. How autism affects the brain. So as you all know, there's a huge proponent of things that can affect children with autism, and their brain is highly affected with this disorder. So one thing that's very much affected is the amygdala. The amygdala is the part of the brain where feelings of love, where fear is housed in a more primitive or animalistic part of the brain. And our feelings of love and kind of where we make our decision making is more in the frontal part of the brain. So if you want kind of try to think of how to separate the brain, the frontal part of the brain in humans is highly more developed than it is in animals. This part of the brain is what separates us from animals. This is where our higher order of thinking comes from, and how we can make logical decisions, how we can differentiate something that's good versus something that's bad. This is kind of where our filter is in terms of when we talk to people as well. So things that we know are appropriate to say or aren't appropriate to say kind of goes through this filter in our frontal lobe and tells us whether or not how we should act on that. Whereas the amygdala is part of the limbic system. So this is the part of the brain where it focuses on memory and emotion. For example, the main job of it is to help you remember scary things that you need to know to survive. So for example, if you step on a snake and it hisses at you, you're going to remember that in the future, that you kind of fear snakes. That's just kind of an example of that. So many children with autism have abnormalities of size and activity of their amygdalas. The excessive fear that they're experiencing tends to emerge as social anxiety, but it can also present as phobias, general anxiety, sleep problems, OCD, lack of impulse control, anger, depression, paranoia, and even substance abuse later on in life. Now, constant stimulation of the amygdala can cause children to be fearful. Unfortunately, children with autism have problems with communication already, so their fear may be misexpressed as aggression, acting naughty, or even repetitive actions, which helps bring more order to their brains. Another part of the brain that is affected in autism is the thalamus. And this is the part of the brain that screens out constant sensory information that we're exposed to. So children with autism, however, since they have this reduced size and function of the thalamus, they're constantly being bombarded by stimuli. So if you think of a good way to kind of understand how this may feel is think about in the morning when you wake up, you put on your socks, you put on a shirt, and sometimes you feel that tag in the back of your shirt that's super itchy and it keeps bothering you and you kind of itch, and then eventually you forget about that tag and you continue on throughout your day. However, in children with autism, they have the inability to kind of screen the sensory input into their brain out. So they not only do they feel the tag on the back of their shirt, but they're very hyper aware to the fan that's running in the room, the people that are talking on the other side of the room, someone who's clicking their pen constantly. These children with autism are constantly being bombarded with the stimuli, and they have no way of screening it out. So they are just constantly being exposed to these things. The stimulation, along with their anxiety, this could also explain their desire to fixate on simple or repetitive tasks. So this can be why they are constantly wanting to do something over and over, like picking something up or putting it down. This stress causes the endocrine system to release a surge of stress hormones, or cortisol, which can affect the amygdala even more. So these children are constantly in this heightened state of being stimulated by things that surround them, and then the inability to communicate it, that they feel this way. Another part of the brain that's affected is mirror neurons. And I'm not sure if any of you have heard of these before, but what they are a special class of brain cells that fire when an animal or person registers awareness of what someone else is experiencing. So for example, if I see someone on the other side of the room from me or sitting next to me eating an ice cream cone, I may start to salivate and I may start to become hungry, and then I start thinking about how ice cream. Well, what's happening in children with autism is they have malfunctioning systems of their mirror neurons, which makes it challenging for them to understand how others feel and therefore makes it difficult for them to care. So what they did was they did a study of children with autism using MRI scans, and they compared them to a group of non-autistic children. The children with autism registered very little activity in their mirror neurons when they observed photos of people who were making facial expressions of anger, fear, and happiness. So kind of what's happening here is these children are unable to recognize emotions in people. So it causes anxiety. Imagine walking down the street and not being able to read any of the emotions of people around you. And it also is an obstacle to love. With no feedback from the interaction of facial expressions and body language, children with autism have a difficult time interpreting this. So when they are feeling stressed or when they're feeling unhappy, if their mom or their dad is trying to give them a hug or trying to give them a smile, they can't really understand that it's love that someone is expressing to them. So they have a harder time interpreting the emotions that other people are putting on them. So potential causes of autism, some things that we're going to get into. Heavy metals, yeast overgrowth, inflammation during pregnancy, infection during pregnancy, and GI dysfunction. Heavy metal exposure. So where this can kind of come from, a lot of people wonder, okay, I understand that heavy metals can be a cause, but where are these coming from? So excessive consumption of fish. Large fish have significant amounts of methyl mercury. Methyl mercury is also fat soluble. So if you get kind of a cheaper fish oil supplement, there may be times where this methyl mercury isn't actually completely out of it. It can taint some of these supplements. So that's why it's important to always buy good quality supplements from reputable companies, especially with your patients when you're encouraging them to get supplements. Mercury fillings in pregnant women, so they can be exposed to mercury that way. There's lead in toys and paint. And then other types of meat can be infected with arsenic. Drinking water, cans, cookware, and baking powder can contain aluminum, and cigarette smoke can contain cadmium. Mercury toxicity symptoms. So the reason that I put this slide up here is I think that a lot of these symptoms are very similar to symptoms that children with autism may experience. So this may include irritability, anxiety, unsteady walking, decreased hand-eye coordination, increased aggression, decrease in intelligence and memory tests, weakness, headaches, hearing loss. So these are a lot of the same symptoms that children with autism may experience. So you can kind of see the correlation as we move forward through the rest of the slides. Heavy metals in baby teeth. So recently, researchers did a study where they looked at the teeth from children with autism and they compared them to teeth of otherwise normally developing children. And what they found was the baby teeth in children with autism contained more lead and less of zinc and manganese. So how they determined this was they used lasers to map the growth rings in baby teeth, kind of how you can cut a tree in half and you can look at the tree trunk and you look at the different rings to see how old the tree is. You can see how good of a year the tree had based on the space in between the different rings. So they're actually able to map the teeth or the growth rings in the teeth similarly to this. And the most notable thing they found was that a lot of lead was found following birth in children with autism. I think that this quote by Cindy Lawler is just, she makes a very good point in what she's talking about. We think autism begins very early, most likely in the womb, and research suggests that our environment can increase a child's risk. But by the time children are diagnosed at 3 or 4, it's hard to go back and know what the moms were exposed to. So I think this makes a very good point on, we can kind of correlate different things that are going on in the children, but by the time they're diagnosed when they're older, it's really hard to tell what may have been the cause, if there is just one cause. Heavy metals identified via blood and urine tests. So this is another test looking at comparing children that are developing normally against children that have been diagnosed with autism. As you can see, the autism group is the red boxes, and the control group are the blue boxes. So you can see that in almost all of these heavy metals, children with autism were significantly higher. So what's happening during this is children with autism have an impaired ability to excrete toxic metals. This could be due to low glutathione. So glutathione is one of the strongest antioxidants that we can have in our body. And by having low levels of this, it makes it more difficult to excrete toxic things throughout our body, whether they're metals or not. It's also been found that oral antibiotics can decrease the ability to excrete toxic metals via the feces. So not only are some of these children affected with low antioxidants and the inability to excrete these toxins, but if they've been sick and they've been prescribed antibiotics, this continues to decrease their ability to excrete these toxic metals. It's also been shown that antibiotics can almost completely inhibit the excretion of mercury due to their effect on altering gut flora. So you've already seen how many children may be affected with these toxic metals, and now we're looking at them and seeing that they don't have enough antioxidants, so their ability to kind of excrete this from the body is hindered. Higher levels of toxic metals can suggest not only increased exposure, but also increased absorption and or decreased fecal excretion, kind of just going over what I just said. This is another study that found that children with autism on average had higher levels of lead in their red blood cells and higher urinary levels of lead, tin, and tungsten. So just another study showing the number of children that may be affected with heavy metals. A regression analysis has revealed that some toxic metals are strongly associated with variations in severity of autism. So they've found a lot of research where the more heavy metal toxicity that children with autism have may show more severity in their case. Chelation therapy. So chelation therapy is one of the most commonly used therapies to help eliminate metals from the body. There's several different kinds, but DMSA is the most common one used in the United States. The reason being it has the least number of side effects. But with that in mind, we can also use nutrients to kind of help clear these toxic metals from the body as well without going straight to a drug, as you can see here. So we can use N-acetylcysteine, selenium, lipoic acid. And lipoic acid you have to be careful with, because what it can do in the beginning, if enough of the heavy metals haven't been excreted from the body yet, is it can actually transfer metals from the peripheral tissues towards the brain. So lipoic acid isn't something that we would supplement right away when we're trying to detoxify these metals. We can also use vitamin E, cilantro, vitamin C, glycine, garlic, and sauna treatments. So sauna treatments will increase the amount of sweat that these children will, they'll get really hot and they'll sweat a lot more, so it will help increase the excretion of their mercury in their bodies. This is a two-part study of autism. In this one, patients, so this one had children that were diagnosed with autism, and they received one round of DMSA chelation therapy for 3 days. This study found that there were large increases in excretion of lead and mercury after the first dose and after round one. And the children that had a high excretion of these metals continued to phase 2. So phase 2, they did another round of chelation therapy, as you can see right here. So these participants, or these children that were part of the study, benefited from both one treatment and 7 more treatments of chelation therapy. So that was the second part of the study. After the therapy, they found that 77% of the participants had improved autism scores. 77% that's a pretty significant number, over 3/4 of the children. 12% had no change in symptoms, and 11% had worsening of symptoms. Researchers reported that the most common side effect, or the most common effect, was hyperactivity, and they said that this was temporary. During this study, the children were supplemented with a multivitamin before their therapy, so they could avoid depleting essential vitamins and minerals. chelation did increase loss of potassium and chromium, so the researchers supplemented both of those minerals on those days as well. So the next thing we're going to be talking about is yeast overgrowth within the body. So in this study, they looked at stool samples from children with autism and against a control group of children that were deemed otherwise healthy. And they found that there was an increased rate of infection by Candida in children with autism versus the control group. So 81% of children with autism had Candida in their stools. They found that removing gluten and casein showed to be effective at reducing the yeast. So what can happen is short-chain fatty acids like propionic acid, and these are things that get broken down as we eat different foods. Propionic acid can induce an autistic-like state in lab rats, and it's produced in the body through the breakdown of amino acids. It has been suggested that Candida produces ammonia as a metabolite. So what happens is, as these amino acids are getting broken down to form propionic acid, they can combine with a metabolite that Candida produces called ammonia. And if these two things can interact with each other within the GI tract, it can be converted to beta-alanine, which is structurally comparable to GABA, which is an inhibitory neurotransmitter. We're going to get into a little bit more about neurotransmitters as we move through this, but essentially these can cause the children to feel more, they can exhibit more autistic-like symptoms or behavioral problems. Mercury and yeast. So this was another study that looked at mercury, people exposed to mercury and the amount of yeast in their bodies. So this was actually looking at adults and not people with autism necessarily, but these workers were exposed to safe levels of mercury, and they were found to have white blood cells and with impaired ability to kill Candida. So mercury and lead, too much of it can inhibit the key white blood cell myeloperoxidase. And this enzyme is what produces the hypochlorite ion, or the body's main defense against Candida. So what's happening is these workers that were exposed to too much mercury and lead were inhibiting their white blood cells. And our white blood cells are what help us to fight off infection. So they were inhibiting an enzyme called the myeloperoxidase, and it's unable to fight the Candida, which means a higher exposure to mercury and lead continues to increase, which, like we already discussed earlier, too much of this can inhibit your ability to excrete it, and too much yeast makes the body kind of unable to purge the metals from their body. So it just continues to grow on each other. Too much toxic metals, too much yeast. Another thing that can occur is infection during pregnancy. So the bacterial population in the mom's GI tract can influence whether maternal infection leads to autistic-like behaviors in the children. In this study, mothers who had severe viral infection during the first trimester had an increased risk for autism, and severe bacterial infections during the second trimester were also linked with an increased risk of their child developing autism. Most of these mothers would have severe infections of UTIs, the flu, different things like that. A question that I get asked a lot is how we can treat people when they're sick during pregnancy. And there are a lot of vitamins and minerals that we can give to women during pregnancy that are safe for both them and their baby. These would include different vitamins, vitamin A, D, C, E. We may give the mother some antioxidants. So there are ways that we can support the mother through an infection during pregnancy without giving them antibiotics or shots. Maternal inflammation. So this was a study that they looked at different parts of the brain. So in this one, they looked at interleukin-17. So that's something that's responsible for breaking down different cells in the body. So it interacts with receptors on brain cells in the developing fetus, which can lead to irregularities or patches in certain parts of the cerebral cortex. And if you remember, if you don't know, the cerebral cortex is in the frontal part of the brain. And like I talked about earlier, our frontal lobe is what makes us human and what separates us from everyone else. So this is our area that we have better decision making, we have logical thought processes, things like that. And these patches are most common in a part of the cortex known as S1DZ. And this area of the cortex is responsible for proprioception, or your awareness in space. So just kind of knowing that I'm standing, my proprioception, if I was to be standing right now, would be that my feet are on the ground, I'm standing on a level, flat, even surface, and I understand that that's where I'm at. If I close my eyes, I know that I'm still standing on a hard surface. So within these patches, their interneurons are reduced, and these neurons are responsible for controlling the balance of excitation and inhibition in the brain. So the researchers found that changes in cortical patches were associated with overexcitement in the S1DZ region. They restored normal levels of brain activity in this area and saw they were able to induce behaviors. They were able to reverse the abnormal behaviors, which I thought was pretty interesting. They also noted that S1DZ sends messages to two other brain regions, the temporal area associated with the cortex and the striatum, and they also inhibited neurons connected to the temporal association area, which was able to reverse sociability deficits. So this isn't research that they've performed on children yet, but I think that it's interesting to see that they were able to reverse these behaviors in mice. Gut dysfunction. So 85% of children with autism suffer from constipation. That's a pretty significant amount. So the infant gut is colonized by a microbiome of the maternal vagina, anus, and skin during delivery. So how this can affect children when they're born, I think a lot of this starts at birth, and if not before. When children are developed via the vaginal route, their microbiota is dominated by 3 different species, as you can see. If they're born C-style birth, the bacteria is more similar to her skin than what they would get from her vaginal tract. Children treated with antibiotics within the first 3 years of life have a microbiome that is less diverse. The reason that this is antibiotics don't have a preference necessarily to which bacteria they want to kill. If it's a broad spectrum antibiotic, it's going to pretty much kill anything that it comes in contact with. So if you're someone that's sick and you take antibiotics, it's going to kill all the bad bacteria, which makes you feel better. And that's why when you take antibiotics, sometimes you feel better after you've been sick. Unfortunately, this has issues later on down the road. By killing off all the bacteria in your gut, you've also eliminated a lot of the good bacteria that exists. So that's why these children may be more at risk. Breastfeeding for more than 6 months shows a lower risk of developing autism, and antibiotics during pregnancy shows a potential risk for the child developing autism. So like I was saying earlier, there are things that we can give to the mother during pregnancy if she's sick that can help eliminate whatever infection that she may have without giving her antibiotics. Because the antibiotics given to her during pregnancy may make her feel less sick, but they may make her more at risk for her child developing autism once they're born. The microbiome and its influence on the brain. So compared with the gut microbiota of children without autism, the gut microbiota of children with autism is less diverse, and they exhibit lower levels of a bunch of different species, as you can see. Children with autism also have a history of using significantly more antibiotics. So like I said, early life events that can alter the composition of the microbial community, especially the delivery mode and antibiotic exposure, are risk factors for children with autism. The gut-brain axis and autism. So more about the gut. The gut influences brain function through the neuroendocrine, neuroimmune, and autonomic nervous systems via microbiotic toxin production. So the mucosa of the GI tract contains millions and millions of neurons, and this makes up the enteric nervous system, which regulates GI functions. So basically, the gut can talk to the brain via these neurons that they have. There's been a lot of research in the last few years coming out that they're referring to the gut as the second brain. So there's been some interesting research also with mood and the bacteria that makes up our gut. There was one study that they did in women where they had women, they separated into 2 different groups, and they had them look at different pictures. So these pictures were different emotions or different things that would stimulate an emotional response or more of like an anxiety response. So the women they found that had more of an anxiety response or a fearful response to these pictures they were exposed to, they did stool sampling in these people as well and found that women with more anxiety had a different strain of bacteria in their stools than women that didn't. So they've actually linked that there are certain types of bacteria that can cause more anxiety or more stress to the person. And if we start to eliminate those bacteria via introduction of other probiotics or trying to kill off bad bacteria, they actually have shown improvements in mood without using antidepressants or anti-anxiety medications. So kind of back to where I was talking about, sorry, I got a little off track there. The production of metabolites by certain microbiota, like lactobacillus, can cross the leaky gut to affect brain function. So kind of what can cause the leaky gut, for instance, for example, we'll use candida. Overgrowth of candida or yeast, like I previously talked about, can start to inflame the lining of the GI tract. When this happens, these tight junctions that make up the walls of the GI tract can start to kind of separate a little bit, and you'll get these little holes or little areas that different things can seep into. So what happens is these neuroactive compounds can cross the leaky gut, so they'll kind of fit through these little holes or these little open areas, and then they go straight into the bloodstream, which can then influence the brain and can induce abnormal behaviors. These compounds can directly influence the HPA axis and increase circulating cortisol levels. So like I said, again, if cortisol levels start to increase and the child starts to become very stressed, that amygdala, that area of the brain responsible for fear, starts to go into overdrive again. So the child may start to become more anxious or more frustrated, and with their inability to communicate this to the people around them, it may be expressed as bad behavior or repetitive behavior. Organic acid testing. So this is some testing that we can do via urinalysis. And the reason we test the urine is because it's up to 100 times more potent than what the red blood cells would. And this is because once it goes through the kidneys, and goes through the glomerulus and has been filtered through, it doesn't get reabsorbed. So at that point, the metabolites just get excreted from the body. So that's how we're able to that's why it's so much stronger when we do a urine test. When candida grows out of balance, it can disrupt areas of the intestinal wall, producing toxins and leading to leaky gut syndrome, like I previously mentioned. Many children in the autism spectrum have an overgrowth of certain Clostridia species, which produces a compound called HPHPA. This may disrupt dopamine metabolism by interfering with the enzyme dopamine beta hydroxylase. So this is a potent toxin with profound neurological effects. It can lead to moodiness, tantrums, anxiety, aggression, or self-injurious behavior. So this is just kind of a screenshot of what this test may look like. You can see the arrows pointing at that metabolite, the HPHPA, and you can see there the red H indicates that it's elevated. So different testing that we can do for children with autism. Of course, we'll be looking at heavy metals. Hair analysis is easy and cost effective. However, the only bad thing about that is mercury will only show up if exposure has been recent. Blood testing, least sensitive but most significant indicator of toxicity of metals. A DMSA challenge test. Stool samples, immunoglobulins to look and see what type of infections may be present in the child. Food sensitivity testing and organic acid testing. So we already looked at the organic acid test. Now we're going to look at some stool samples and food sensitivity testing. So the picture on the left is a comprehensive stool analysis. And this test looks at all the different species of yeast, bacteria, and possible parasites present in the body. So it's kind of hard to see, but you can see that there's 3 different colored columns. So the green one is good bacteria that's existing in the body. So you can see there's a 4, there's a 2. Those numbers kind of grade the amount of bacteria present. The yellow is bacteria that isn't good, but isn't bad. It could potentially cause harmful effects if there's too much of it. but it's not something that we want to have too much in the GI tract. So you can see there's kind of a lot of things listed in that middle column. And then the red one, or the far right column, is dysbiotic flora. So this would be bad bacteria that's existing in the gut. Now this is just a sample picture from Doctors Data's website. So this isn't an actual patient of mine, but as you can see, by looking at those different bacteria, we can see how we want to treat this patient specifically without just blindly guessing and supplementing them with an antibacterial. We can pick something that's more specific to each of those bacteria. So the picture on the right shows us a food sensitivity panel, and this looks at IgA and IgG. So the difference between an allergy and a food sensitivity is people typically with an allergic reaction to food, for instance, let's say we have someone that's allergic to peanuts. They have peanuts and they have an IgE reaction, or an allergic reaction. This would cause their throat to close up and the patient to potentially go into anaphylactic shock. This is due to the amount of histamine released in the body. When the body recognizes something foreign that it's allergic to, it causes a surge of IgE, and then that will in turn cause a surge of histamine, and that's what causes the swelling, the throat to close, those different things. So sensitivities aren't quite as serious or severe as what allergic reactions would be. The IgG is creating an antibody-antigen complex, and if it's present in large amounts and reactive food is still being consumed, macrophages that typically kind of break these complexes apart can't keep up. And this accumulation will eventually release toxins. So these symptoms of sensitivity and IgG sensitivity may manifest as a headache or a stomach ache or eczema or skin irritation later on down the road. However, sensitivities, unlike allergic reactions, don't occur immediately. So you won't eat something and immediately have a response to it like you would with an allergy. IgA is antibodies may form to foods when the lining of the GI tract and or mucous membranes becomes inflamed or damaged. So this response occurs similarly to IgG, but these symptoms, or IgA, will affect mucous membranes. So you may realize that you have a glass of milk, and maybe the next day or maybe even a few hours later, you start to realize that you have a little bit more phlegm in your throat than you did before, or you're a little bit more congested. That's typically an IgA response. So we'll test children for these sensitivities and eliminate those foods as well, because they continue to create inflammation throughout the body. So different treatments for children with autism may include chelation therapy, addressing nutritional or mineral deficiencies, probiotics, essential fatty acids, removal of gluten and dairy, ketogenic diet. So this has been shown to increase sociability and decrease repetitive behaviors, and also improving social communications. Low sugar diet. Sugar is super inflammatory to the body and brain and can also support yeast growth. And then some of the other things we may give them would be glutathione, the strong antioxidant I talked about, and vitamins A, D, E, and C, which are also very strong antioxidants. ADHD. So symptoms of children with ADHD may include constant fidgeting, difficulty focusing, quick-tempered, difficulty paying attention, difficulty controlling behavior, and hyperactivity. So we're going to talk about the brain a little bit more again. ADHD in the brain. So the lower brain is the first place most information comes to. That's where we get our visual and our hearing senses from. This information is then sorted out by the thalamus. So we talked about the thalamus and that children with autism have, and how kind of the dysfunction in that, works. So children with ADHD often have weak function of the thalamus as well, like I said, and they aren't very good at sorting out this information. These children may perceive the world as a chaotic jumble of sights and sounds. Interestingly, children with ADHD also have enlarged amygdalas. So as you'll start to see as we're moving through this PowerPoint, a lot of symptoms are very similar in children with autism, ADHD, and anxiety. A lot of times we'll see that as we start to treat children with autism, they'll eventually start to kind of transition more into an ADHD type presentation. And then they'll eventually kind of transition into just more of an anxiety type presentation. So it's very interesting to see that they're affected in similar ways. The biggest problem that children with ADHD have is that their brains are not good at sending messages from the lower brain to the upper brain. So from that more animalistic area part of our brain to a more higher functioning or focused part of our brain. Their thoughts tend to stay in the lower part of the brain, which is like in the limbic system. And this system is controlled by emotion, fear, and instinct rather than logic, kind of how I talked about before. So when the path between the lower and upper brain fail to communicate, thoughts can get stuck. So if they get stuck, when we get stuck in the upper brain, this can cause people to be overly rational or too unemotional or lack of empathy for others. These people tend to live within their own head. So this is less common. More often, though, in children with ADHD and autism, the thoughts get stuck in the lower brain, which can prompt behavior that is too much in fear, emotion, and anger. That's why sometimes mood changes are very common in all of these children. They have an inability, they get frustrated very easily and they don't know how to express it, and it comes out as a behavioral issue. And we're starting to find before previous treatments for children with autism and ADHD was a lot of behavioral therapy. However, it's not really the behavior that's bad, it's the communication in the different parts of the brain that makes it challenging for them to communicate with us. When children with ADHD are faced with temptations and impulses, they're unable to evaluate them rationally. That's why they are often impulsive. So they have kind of a filter in the front part of their brain, which makes it difficult for them to kind of know what decision they should be making. Since that frontal part of our brain is what tells us what's appropriate and what's not, and they kind of have an inability to send messages from the lower part of their brain to the higher part of the brain, this is why they'll have these problems. The frontal part of the brain, which many of you have probably heard, is also what's affected in Alzheimer's disease. And that's why we see as people progress throughout this disease process, they pretty much say things without a filter. Their thoughts aren't extremely rational, and they're impulsive at times. You can also think of impulsivity in the frontal part of the brain being related to drinking alcohol. So for instance, when you drink alcohol, part of the effect is cut off communication paths to the frontal lobes. So when this happens, this is why people may lose their inhibitions and do things that they later regret. That's because they're not having the communication between the lower part of the brain and the higher part of the brain that they would typically have when they're not under the influence. So more on the brain. The reticular activating system is often dysfunctional in children with ADHD. It's the primary attention system of the brain and is linked intricately to the frontal lobe. So this system sends information all around the cortex, or the frontal part of the brain. And if the system is functioning slowly, the brain may have difficulty staying on task. This can result in classic signs of inactivity, so easy distractibility, difficulty in learning, lack of focus, and this is the attention deficit part of the brain. If it's overly aroused, it can create the opposite symptoms: restlessness, impulsivity, tendency to pick things up and kind of just throw them down at random, being obsessive, and talking too much. And this system is controlled by a few neurotransmitters, so serotonin, acetylcholine, and dopamine. Low serotonin can result in agitation, restlessness, and anxiety. That's why we'll typically see SSRIs, or serotonin. Those medications are specifically focused on serotonin release in the body, so that's why they're given to people that have anxiety. Low acetylcholine makes it difficult for neurons to move throughout the brain, and this can cause brain fog. And low dopamine, which is what's focused on the most in children with ADHD, can have the inability to trigger arousal and low mood. So this could be why children with ADHD typically may not feel motivated to do things. So on that note of low dopamine levels, that's what most medications aim to kind of affect, are the dopamine pathways. So abnormalities in the frontostriatal brain circuitry and possible hypofunctioning of dopaminergic pathways are apparent. So what they'll give children will be these first-line stimulants: methylphenidate, otherwise known as Ritalin, dextroamphetamine, dexedrine, and Adderall. Methylphenidate acts on the central nervous system with a dopamine agonistic effect that is slower in onset, but mechanicalistically almost identical to cocaine and amphetamines. The second line of commonly prescribed ADHD medications is methamphetamine. So they're giving children methamphetamine to help them control their behavior, to try and affect those dopamine pathways. Dopamine deficits occur in these children due to receptor dysfunction. So there's 12 different receptor sites for dopamine. D4 is the one that's most commonly affected. This receptor needs to be methylated to function well. And when the detoxification process of methylation breaks it down, it allows too much dopamine at the receptor sites. Too many of these can cause the D4 receptor to shut down, and then there's a shortage of dopamine activity. So there's way too much, and then it shuts down, and then there's not enough. This malfunctioning D4 receptor is genetic. We've actually found that methylating the D4 receptor by giving something like methyl B12 can actually resolve this problem. So we can give children methylated B vitamins, and they seem to kind of regress from their symptoms that they may have been experiencing without having to give them medications. Common effects of psychostimulants, and the reason I say effects instead of side effects is every drug has an effect on the body. It is how we sell it or how we kind of perceive it to other people, whether or not it's a side effect or a real or an other effect. I heard this in a lecture from someone before, and I liked the way that he put that. Every drug causes an effect on our body. The fact that we call it a side effect doesn't make it any less of an effect on the body. That's just how we market it as a side effect. So common effects of psychostimulants are increased focus, weight loss, insomnia, headaches, tics, growth delay, nervousness or anxiousness, tachycardia or an increased heart rate, and heart palpitations, leukopenia and psychosis. So leukopenia is decreased white blood cells. Too low white blood cells can kind of set you up for infections if you don't have enough to kind of help fight those infections. They can also have withdrawal symptoms and addictive symptoms. And the rebound effect, so this happens when the drug starts to wear off and the child will have, they'll kind of surge in the opposite direction. So they may have had good behavior on the drug. And as it starts to wear off, they start to act out. They start to pay less attention. And then they're perceived as being bad or acting badly. And so their drug prescription just gets increased, or the amount gets increased. This may also cause blood sugar handling issues and decreased appetite secondary to anorexia or nausea. So these are effects of psychostimulants that we are giving to children. It's kind of frightening to me to think that these may be effects that young children are facing. Possible causes. So a lot of these things are very similar to what may be causing autism. These things can include food sensitivities or allergies, gut dysbiosis, thyroid disorder, toxification of the brain and body, PANDAS, something we're going to talk about, in utero stressors, and nutritional deficiencies are very common in these children as well. The thyroid hormone is essential for normal brain development. It regulates development of cholinergic and dopaminergic systems, serving the cerebral cortex and the hippocampus. So if you remember, we talked about how closely the dopamine pathways are kind of associated with this disorder. These are the symptoms of hypothyroid and hyperthyroid. So I think that some of these, more the hyperthyroid than the hypothyroid, but as you can see, the hyperthyroid symptoms are very similar to ADHD symptoms. Difficulty staying still, brain fog. So I thought this was kind of interesting to look at. Thyroid dysfunction. So general resistance to the thyroid hormone. What's happening here is this does not allow the body to properly respond to the thyroid hormone. So what's happening is instead of the pituitary lowering the production of TSH, it remains the same and continues to produce more hormones. So the body will just keep producing more and more and more thyroid hormone, causing you to be in a hyperthyroid state. There was a study that found increases in maternal TSH in early pregnancy showed significant association with girls developing ADHD symptoms. Those babies born that were girls had increased symptoms later on. It's also been associated with a mutation in the thyroid receptor E gene, which can lead to resistance to the thyroid, which later on in life can lead to thyroid resistance. And this research has been correlated to find, it's found similar findings in children with autism. So like I said, you'll start to see a lot of the same symptoms and a lot of the same tests and studies in children with ADHD and also children with autism. There's also a lot of research and reading out or different writings out there that have suggested that ADHD is somewhat on the autism spectrum, but at a very more mild place. So these are just kind of some things that continue to talk about thyroid dysfunction and its relation to ADHD. So it is very important to check TSH, free T3, free T4, anti-TPO, and reverse T3 when checking for thyroid disorders in both women looking to become pregnant and also women that are pregnant. It's very important to address thyroid function. There's different supplementation and different hormones that we can give to women that are safe for them to take through pregnancy, nutrition-wise. So that's something that we can have an effect on if we look into that. Elimination diets. So this study looked at children, 100 children, and they were either enrolled to a control group or to a diet group. So the children that were assigned to the diet group had a restricted diet, and which mainly consisted of rice, meat, veggies, and fruits and water. The other group was unrestricted, and at the end of 5 weeks, 64% of children on this restricted diet had significant improvements in their behavior. So all this study did was had them eliminate certain foods, and 64 of them showed improvements. This was without any supplementation or any other form of care at that point. So one thing I'm going to talk about is pandas. Not a lot of people have heard about this. The reason I think that this is relevant is this is something that can kind of lead to autism or ADHD diagnoses. So what this acronym stands for is pediatric autoimmune neuropsychiatric disorders that are associated with streptococcal infections. So we're going to talk about the brain again. Pandas in the basal ganglia. So the basal ganglia, like I talked about earlier, is one of the primary links between the brain's calming advanced areas and its more primitive animalistic areas. So attack on this important link can cause serious malfunctions of thought and behavior, which can include tendency to fly into sudden uncontrollable rages that we see in both ADHD and children with autism. So what's happening is advanced area of the brain consisting of rational, inhibitory, logical regions of the upper brain, the neocortex or the frontal lobe. So this is the area that's being affected. And then the primitive areas of the brain, like I talked about earlier, are governed by the highly emotional limbic system, which includes the brain's fear center, the amygdala, which we also already talked about. So this basal ganglia kind of connects these two areas. So dysfunction in this area can lead to an inability to express proper emotion. These infections occur when strep triggers a misdirected immune response, which results in inflammation on the child's brain. The child may quickly exhibit life-changing symptoms, including OCD, anxiety, tics, personality changes, decline in math or handwriting skills, sensory sensitivities, restrictive eating, and more. So these children will almost change immediately or almost overnight after having this illness. Pandas Network estimates that this may affect as many as 1 in 200 children. That's a lot of children being affected. The criteria for pandas is sudden and acute debilitating onset of anxiety that may be accompanied by OCD and tics. So this is also associated with a streptococcal A infection that has occurred immediately prior to symptoms. So in some cases, these symptoms may not show up until 4 to 6 months after the initial infection due to treatment not fully eradicating the bacteria or not receiving treatment at all. So you may be wondering, how would we get rid of this infection without using antibiotics? Like I said earlier, we have a lot of antimicrobial, antibacterial, different homeopathics that we can use to try and eliminate these infections without using antibiotics. So as you can see, these are some of the symptoms that these children may struggle with. Organizing the crayons by color, excessive hand washing, creating patterns over and over again. 90% of reporting families noted that a history of the following in the first or second degree relatives: autoimmune diseases, strep infections, rheumatic or scarlet fever, history of upper respiratory cough, sinus or allergy issues, and family history of anxiety or other issues. Additional triggers: mycoplasma pneumonia, staph infections, Lyme, influenza, overgrowth of yeast. So yeast overgrowth can occur following antibiotic treatment. Because the antibiotics kill the bacteria, it can cause the yeast to thrive within the GI tract. Yeast growth can also increase due to poor diet, so high starchy diets or high sugar diets. And we'll actually see these types of diets more commonly in children with autism and ADHD. Their bodies crave these things like starch and sugar because it's feeding the yeast in their body. So by craving these different foods, they're continuing to feed an underlying infection and continuing to make it worse. That's why the removal of certain things in the diet typically makes these symptoms lessen. So different testing we could do would be strep ASO, anti-DNase, B titer, ANA testing for autoimmunity, CD4 cells to see the chronicity of this. Immunoglobulins G, A, and M can look at the different type of infection that's present. And at times they may do MRI or PET scans. And this helps to visualize inflammation in the brain in cases with encephalopathy. So this doesn't always occur, but they'll use those at times. The reason I think that PANDAS is so significant in autism and ADHD is this infection, as you can see, can kind of trigger symptoms that you see in both autism children and children with ADHD. So I think that this is pretty interesting. Anxiety. So community studies have found that anxiety disorders are the most frequent forms of psychopathology among youth, and this evidence has shown that a significant amount of these cases extend into adulthood. As you can see, this graph kind of shows the trend of anxiety disorders in children, and this was from 1982 to 2006. So this is a pretty big study that they put together. Another study suggested that by 16 years old, 1 in 10 children will suffer from an anxiety disorder. 1 in 10, that is a lot of children by 16 years old. If you look to the picture on the right, the one with the dots, the straight lines and the dots is PTSD. So there's been a significant jump in that over the last, since 1982. The ones with the lines and the X's are OCD. So you can see that that number has continued to go upward as well. So it's interesting to see all these anxiety disorders trending upward. That may be due to better diagnoses with our physicians, but that could also just be related to all of the other things that we've talked about. So different causes of this. So a lot of the things that I've previously talked about with autism and ADHD children are also apply to children that are affected by anxiety, like I said. So these are some of the other ones that may kind of cause these symptoms to show up. Genetics have been shown to up to 50% variance in anxiety problems can be explained by heritability. Environmental variables, so overprotective parenting, direct conditioning, negative life effects may affect these children. Behavioral issues at a young age, so anxious children typically display hyper attention towards potentially threatening material and will often interpret ambiguous stimuli and situations in a threatening way. Clinical point, kind of like I've been describing throughout this presentation, many of the previously discussed issues that affect children with autism and children with ADHD are very similar. The food sensitivities, GI dysfunction, infection can also contribute to anxiety. Gastrointestinal issues. So children with anxiety are more likely to present with GI issues than kids without. They're more likely to have a family member with a problem. They're more likely to have symptoms of constipation. And if you remember how I talked about earlier, 85% of children with autism have constipation. Studies suggest that up to 25% of all youth have chronic stomach pain. In this study, they looked at children 8 to 15 years old presenting with recurrent abdominal pain. They found that these patients were more likely to receive a diagnosis of a psychiatric disorder or 2 psychiatric disorders. So 79% of these children were diagnosed with anxiety, and 43% of them were also diagnosed with depressive disorder. Anxiety disorders with a mean onset of around 6 years old were significantly more likely to precede recurrent abdominal pain. So they were finding that children that had chronic abdominal pain or consistent abdominal pain were more likely to be diagnosed with anxiety disorders later on in life. Dietary changes. So in the early 1980s, two scientists noticed that the behavior of animals under the influence of opioids or morphine was similar to that in children with autism. So what are gluten and casein, and why should we eliminate them from the diet? This seems to be something that we're hearing about constantly in the media right now and in the news, that people are going on gluten and dairy-free diets. So what they are is both gluten and casein have a molecular structure that is very similar to opioids. So kind of how I was talking about earlier, the differences between allergies and food sensitivities, many of these children have sensitivities, but not always allergies. So they won't have that immediate response, like the anaphylactic response that you would with an allergy. Incomplete digestion can lead to amino acids bound to short chains, and these are called peptides. So kind of earlier how I talked about the propionic acid. These can function like opioids and can kind of exhibit autistic behavior. Although most of it is eliminated, the body, those macrophages will eliminate those most of the time. Sometimes they may escape the leaky gut and enter the bloodstream, and that can eventually cross the blood-brain barrier. So although, like I was talking about earlier, when you have constant exposure to things that you're sensitive to, the body can't keep up with breaking them down and excreting them. If you have someone that also has yeast overgrowth that the body's trying to fight against, not a lot of bacteria in the gut to help fight the infection, and overgrowth of bad bacteria, there's a lot of things going on that can cause this leaky gut to occur. So what happens is constant exposure to these opioid peptides can have damaging effects on the developing brain, similar to how a narcotic would work. Buildup of opioids can also lead to higher pain tolerance, repetitive behaviors, and lack of concentration. So all three symptoms that we see in anxiety, ADHD, and autism. Lots of these children will have poor diets, like I previously touched on. So you usually find them eating a lot of carbohydrates and a lot of sugars. Like I said, feeding that yeast growth, and then also this kind of creates this opioid behavior in the brain, causing them to crave more of it. So that's all I have for today. I know that was a lot of information to get through. I hope you all enjoyed it. If you have any questions, you can go ahead and add them into the question category right now. I don't see any at the minute, but if you want to ask any, I am willing to answer some. So this is my contact info if you have any other questions. My office number, our website, my email address, and we are on both Facebook and Instagram. So thank you all for joining me today. It's been great discussing all of these things with you, and I hope you all have a great day.